Okay, so good evening once again. Thank you all for being here. Today, as you know, the Louisiana Department of Health reported 2 additional patients who have been designated as presumptive positive for COVID-19, commonly known as we say the coronavirus, here in Orleans Parish, the city of New Orleans. So we are not releasing personal information in terms of identification for these patients. However, we know that there are 3. We know that they're in 3 different hospitals in the city of New Orleans. And with that, it has caused us to even reassess where we are right now and where we will be going in the immediate future as it relates to the weekend. Because of the 3 individuals at 3 different hospitals, not connected at all based on what we know, we are in the process of the contact tracing, which immediately follows as someone has been identified as presumptive positive. We also, based on that, being in the 3 different locations, meaning the hospitals, it also means that they have been treated by 3 different sets of hospital caregivers. So with that, the concern has grown, meaning to be as proactive as possible in order to prevent any type of community spread. We can't say that there is at this point, but being proactive as it relates to preventing anyone else in our city from coming down with COVID-19. So with that in mind, I've made the decision in consultation absolutely with my public safety team, all of my leaders as it relates to public safety, which will always be our top priority and concern for our residents, for our visitors as well. Therefore, this weekend events, we're making the call, I've done that, to cancel all of them. As it relates to Wednesday at the Square, the Irish Channel parades as it relates to St. Patrick's Day. And there are several. So we have the downtown Irish St. Patrick's Day parade. We have the Irish Channel St. Patrick's Day parade. We have the Italian American parade. We also have the Uptown Super Sunday. Okay. In addition to that, we have the Single Men Social Aid and Pleasure Club second line that was also scheduled for this Sunday. All of these events have been canceled. We have been proactive in this regard as well, making sure that we did the outreach necessary to the event organizers prior to coming out here and sharing this information with you. You know, I try to get to you as soon as possible, but those who are greatly impacted, and I know you should agree with that, having reached out to them on the front end. So with that, I'm going to turn it over right now to Dr. Jennifer Vegno that will give you more information as it relates to where we are in the city of New Orleans with COVID-19. So with that, Dr. Vegno.
Thank you, Mayor. As you know, as Mayor Cantrell said, the Louisiana Department of Health notified us this afternoon of 2 additional presumptive positive cases of COVID-19, which totals 3 cases in Orleans Parish. Again, with the case we discussed earlier, the verification is being sent off to CDC as per the protocol. The Louisiana Department of Health is moving forward, as with the first case, assuming that these tests are positive and taking immediate actions. That includes investigating who the individuals were recently in close contact with, and the health department will be assisting them as needed in this process. What we know about this virus is that it spreads between close contacts, and close contacts meaning is about 6 feet, through droplets when an infected person coughs or sneezes.
They're talking when they're spitting and talking.
Right. At large events like parades and second lines, we see our attendees interacting very closely for an extended period of time. For this reason, and again, to be proactive and out of an abundance of caution in order to prevent further spread, the health department has recommended to the mayor and with her public safety team to cancel these week special events that you just heard. Again, this is the time to take action and prevent and protect yourself and your loved ones from further spreading disease. Wash your hands frequently with soap and water, with a hand sanitizer with at least 60% alcohol. If you are sick, please stay home. Cover your cough with your elbow or a tissue if you are coughing. Frequently touch surfaces, we've talked about disinfecting. Avoid close contact with those who are sick. Businesses, again, we are asking you to implement work from home policies as they are necessary, or consider the implementation, work through the plans for how that would look, and for sick leave to support your employees. Again, industry-specific guidance is available at ready.nola.gov. There is still a lot of uncertainty about this, but we are being as proactive and as measured as possible. We do know, again, that elderly individuals, those with immune compromise or serious medical conditions, those are the most at risk, and that is who we are asking. Anyone who cares for or is in contact for someone like that, please do what you need to protect them. Thank you.
Thank you, Dr. Avegno. And I'm going to ask, as always, Colin Arnold, who is our Director of Homeland Security, to also come on up.
Thank you, Mayor. Office of Homeland Security and Emergency Preparedness is monitoring the situation again very closely with our partners in public safety and in public health. And we're providing regular situation reports to relevant stakeholders. We're also working with the administration to ensure public safety agencies and all departments take necessary precautions to limit the spread of this virus. Some of those things we're doing it includes communicating with employees, our own employees, to encourage healthy practices. We're preparing leave and remote work policies for city departments, and we're communicating with community stakeholders, including healthcare providers, long-term healthcare facilities, schools, houses of worship, and businesses to ensure that they have the most up-to-date information. As Mayor Cantrell and Dr. Avegno said, we have made the determination that in order to prevent further spread of COVID-19, we'll be canceling this weekend's large public events. This is an action we are taking out of an abundance of caution. Again, this is a rapidly evolving situation, and we continue to take the information we have and make decisions with public safety in mind. My office, the Health Department, and the New Orleans Police Department will continue to be in regular contact with special event organizers during this ever-evolving situation. Just today, we spoke both with French Quarter Festival and with Essence. We are looking long-term at this issue. I'd like to reiterate that we've been preparing for the possibility of local cases for months now, and we are ready to respond to this. As New Orleanians, we are no strangers to emergencies. We are a resilient community. We take care of each other, and we'll do the same with this virus. There'll be no difference. Treat this like hurricane season. Stay informed, stay ready, and heed our warnings. It's important that you pay attention as this situation, again, it's quickly evolving. Make sure you're getting accurate information from reliable sources, including the CDC, the Louisiana Department of Health, and here in New Orleans at NOLA Ready. You can find us at ready.nola.gov. You can follow us on social media at NOLA Ready, and you can get real-time alerts to your device by texting COVID NOLA, one word, COVID NOLA, to 888-777. Thanks.
Thank you so much, Colin. Well, that's what we have to share with you at this time. We'll continue to give you updates as we learn more. We are absolutely in the contact tracing process as it relates to our 3 residents that have been positive and presumptive positive at this particular time. So with that, Ms. Latanya, you want to ask any questions?
Yes, Madam Mayor. Foxy.
With regards to testing, do we have a number or a figure of how many people are being tested on the whole outside of just these 3 patients in New Orleans? And what does that mean for testing that's supposed to come online this week with commercial locations?
The Louisiana Department of Health keeps the numbers of testing as of this afternoon. Before the 2 positive cases that we found out about, I believe there were in the 50s of people who had been tested. Again, as commercial tests come online, we do expect that number to increase. I don't have any information about exactly how many tests will be available commercially locally.
We're advocating for as many as we can get. so that we can be as proactive as possible. Yes, sir.
We, as well as you, I know, have been trying to promote facts and not fear. Is there anything that you can say to people who are watching this and they're starting to become fearful of this, just to ease, their concerns? I know that no good can come from widespread panic. Is there something that you can say to?
Well, first of all, don't let fear be our friend, because it doesn't, it incites, anxiety, which could be harmful. And so we want people to stay calm. We want people to stay informed and let the facts truly guide them, but at no time be alarmed. And I'm really trying to demonstrate to the public by being calm, by listening to the experts and the professionals closely aligned with this, and just being that example for our citizens and for our residents. We know, and look, I always say I'm not just a mayor, I'm a mom as well. So I understand, from that perspective as well. We are in constant communication with the school community. We will be organizing, every day, just on top of this battle rhythm, so that everyone has the best information possible, and even as it relates to the regional outreach, as well. So with that, I appreciate the question, but really encourage everyone to just stay calm, listen to the facts, do not panic, but take every precaution necessary. Wash your hands, make sure our young people are doing the same. It's that friction of washing that really helps the best, not just running through like the bird bath kind of concept. Don't do that. As it relates to just making sure that if you're sick, respect yourself, but in doing so, respect others in that regard. Stay on home, and we're going to be, again, doing that as it relates to taking these precautions within city government as well.
WDSU.
Okay, what can you tell us about the Orleans Parish residents? And then also, did any of them come into contact with each other?
What we do know at this particular time, none of them are related, meaning no contact with one another, nor cases related, to one another. There are 3 independent cases, and they're at 3 different hospitals in the city, which has caused us just to raise the alarm just a little bit, because again, 3 different hospitals, 3 different groups of medical professionals that are also associated. And so again, just trying to be as proactive as possible in terms of detailed information through the contact tracing. I don't have anything to share with you at this time.
We don't know if any of them traveled anywhere.
No, to my knowledge, no. I know that we were waiting for the state of Louisiana to officially declare that, but to my knowledge, that doesn't, for me, it seems like they have not traveled. I did have one give me a call, and which was out of the blue, and I was in a briefing, and ended up putting the individual on the conference call with my professional staff. And so with that, that's all we have, and even to share.
WGNO.
To those doctors and nurses who helped the patients, do they have to self-quarantine as well?
Those steps are not only in place, but that process is unfolding at this time. Doctor, you want to speak to that?
Sure, yes. Each of the hospitals has been very vigilant in compiling lists of who might have come into contact with the patients, and they are working with the State Department of Health and the epidemiologists to give guidance to those healthcare providers, and so I know that's ongoing.
Mm-hmm. Absolutely.
The Advocate.
Colin mentioned conversations with French Quarter Fest and Essence. First, are there also conversations with Jazz Fest?
Oh yeah, absolutely. Yeah, we reported that yesterday, but those are ongoing conversations with Buku, as well. We have a call or a meeting scheduled, I think that's Thursday, with all of these large festival organizers, and we'll continue to do the outreach that's necessary.
Are there specific things that will make a decision one way or the other about whether those events will go on, or what will cause you guys to say, look, you can't do this right
Well,
now?
one, as it relates to more cases that become factual in terms of being positive, presumptive positive, also where they're coming from, if they're linked or not. It's just that type of information that we will continue to monitor. It's absolutely fluid. At this time, even flexible is just too rigid. And we're going to assess as we need to. Dr. Vegno and Conley, you want to add?
You know, another big part of this is we want information from them. I think what you're seeing with South by Southwest in Austin was there were issues with the festival itself as far as sponsorship, acts pulling out, insurance. And so we've asked that these organizers, one, have contingencies for everything that they're doing. Two, that they look and listen to what we are communicating as a community and amplify that. You know, one of the big ones is if we're gonna have this festival, if you're sick, don't come to the festival, you know? And we're hoping that that messaging helps. And three, I'd like to hear from them, we'd like to hear from them, if acts start pulling out, if sponsorship starts pulling out, that's gonna change the dynamic of some of these festivals. And regardless of where we're at, and what we're doing as a city is, as the mayor said, we're looking at these cases, and if this continues to kind of, as an incident, expand, you know, those decisions will have to be made. But for right now, we're looking at this weekend, and that's the decision that was made.
Fox 8, and lastly, WDSU.
You mentioned a work from home leave policy that's being created for the city. How will that change city functions? Because we have a lot of first responders that arguably couldn't work from home.
Sure. I mean, well, it's multiple, right? We have hundreds of city employees that provide various services to run city government. So we've been looking through all of that. We're looking to also use the federal policy in terms of work from home. And I also have our CAO, Gilbert Montano, who has been really pen to paper in going over not just the work from home policy, but also those frontward facing online types of business too, because we want business to continue. And so we are structuring processes that deal with certain permitting and the like. Gilbert, you want to talk to some of this? Sure.
Thank you, Mayor. So like the mayor said, there's contingencies being established and being developed currently so that we could have two parts. Those employees that are able to stay and work from home, non-public safety entities, have a workspace and a VPN access to be able to do their day-to-day jobs, but then also from the public side, the ability for them to interact with City Hall without having the need to come downtown, be in a crowd, or in some cases, if we have a limited space where people aren't in lobbies together waiting, so maybe more like a scheduled type appointment as it relates to that. So every step that we're looking at, and then also all the back office work related to how we would handle specifically with a hurricane and a very similar path moving forward. So all the steps looking into place, we're having to recreate this, but as the mayor said, we're typically working off the federal model to be able to allow and pertain to civil service rules and all the other engagements that we're having to tackle.
And even budget codes, you know, associated with tracking any expenditures that will be associated with this COVID event, so that we are being very mindful of the budget and also just the financial implications that it will have.
Yeah, so exactly, there's organization code, there's budget codes. We've had to free up at the mayor's request cash flow in case we have periods of time where we'll have to make emergency purchases, procurements, a battle rhythm that we understand and have utilized in many cases. We're just augmenting it specifically for this epidemic potentially and in preparation now.
Does this include changes to travel or travel requirements, restrictions?
It will have an impact on there. We have not moved forward just yet on that. That's something that we'll continue to work after we inform you of this, and then we'll come back with more information. But like, for example, I was scheduled to go to DC tomorrow, a very important meeting, a committee to testify on behalf of not only the city of New Orleans, but our region. And I have decided to not do that because as cases, right, where we are now, I want to be as close to home as possible should decisions need to be made.
WDSU.
As far as the mayor's mass ball, are you canceling that as well?
Right now, it's not canceled. Right now, it's not canceled. That is more of a private event. Thank you for asking. That is to benefit our HBCUs in the community, Dillard and Xavier. But right now, it's not. But that could potentially happen. But again, just stay tuned to information that comes through the city of New Orleans.
And then as far as the CDC results, when can we expect them to come back?
Well, yeah, you're asking the same. I want to know too. Yeah, I was told, when it gets to CDC that the time frame is, a few hours, and of course we're over that. But Doc, you want to give us an update?
So
I don't want
CDC
to bash CDC.
Generally, the state lab has a turnaround time of a few hours, as we've said. Once they get a sample and are processing a sample, the CDC has been a few days, and that's been fairly consistent. So we don't have the results back, and we probably won't for another day or two, maybe on the 1st in a day or two.
Okay.
So these might take an extra day or two.
Okay. Well, but the thing is that we're acting as if they're official by CDC, so we're not waiting, and that's important for the public to know that we're not waiting, but we're using extreme caution, and we want people to remain calm.
Madam Mayor, we have one last question we ask you.
So y'all have mentioned the meeting on Friday with the healthcare providers. I'm curious, it seems like they were not involved in the tabletop last week, and I'm curious why they weren't involved in that. What's the schedule like?
The meeting we're having at the hospital.
Oh, okay, yeah.
I'll
Yeah,
start.
presidents,
So,
yeah.
right. We've been having constant communication with them, so we have all been communicating. The tabletop exercise was really for non-clinical scenarios. What we look to our healthcare providers, to our nursing homes, dialysis, to make sure clinically we are understanding what our capacity is. It's, the tabletop scenarios that we ran through are important in terms of public safety and things like the port and MSY and the cruise ships and that sort of thing. To a clinician, it doesn't really matter where the patient was, if they were on a cruise ship, if they were, some other place in the community, because once they get to a clinical setting, then we need to make sure that the clinical processes and protocols are all the same and the capacity is there. So it's really speaking two different languages. However, that does not mean that we have not been communicating with them and that they're not aware of all the planning that's been going on.
Yeah, and the larger umbrella.
They just have a
The
representative.
Department of Health has a
That's
Region 1 hospital coordinator. She's well known to this office and has been doing this for over 20 years, including all the way through Katrina. She was at the exercise. as
Dr.
usual.
Cantor.
She Dr. Cantor, who is our Region 1 medical director, was on the call as well. And so, and also the hospitals were having a meeting as a group, just as out of coincidence that morning as well. So we're now to let them do the work that they need to do internally as hospitals, as Dr. Avegno said, and we do our work on the public safety side.
And we've also gotten questions from people concerned for these patients. Is there anything you can elaborate about their conditions? I know they were displaying symptoms, but are they doing okay, or is it something to fear for their health?
Well, what we do know is that one is in ICU. There's another. Now this was there was another that is not in ICU. He was able to talk to me. Said he was, he could be better. That's actually what he said. I could be better, but at any rate, was hanging on in there. And then I don't know about the third. So that's really all that we have at this particular time. And the best news possible is that they're getting the care that they need and they deserve. So that's like the number one priority.
And do you care to share how you know the person who called?
Like I know people in the community all over the city of New Orleans. That's really it. It's just, it's a fact. Mm-hmm. Thank you all so much.